Hello everyone, this is Adam Stewart from stewartmedicine.com. This is just a follow-up video on the topic of cardiovascular risk. And in this video we're going to show some examples of a few different patients who might have different risk categories, low risk, medium risk, or high risk, and how we might recommend different prevention methods or treatment methods depending on a person's risk category. So let's take, for example, a patient who is 45 years old, female, never smoked, no diabetes. Let's say she has really good blood pressure, not on any blood pressure medications, and let's say cholesterol is really good, and let's say there's no family history. So if we were to take 100 patients with these particular risk factors, 45 years of age, female, etc., or clone the same patient 100 times over, and we were to follow those patients for 10 years, the risk of that patient having a heart attack or stroke over the next 10 years is very low. It's estimated at 2%. So out of 100 smiley faces, 2 of those patients, unfortunately, but still very low risk, are going to have a heart attack or stroke based on statistical analysis. So with a patient like this, they're at a very low risk, so putting a patient on a cholesterol pill has limited benefit. The person could basically have very, very high cholesterol, and their risk factor is not changing much. 7 would be extremely high, but let's say their cholesterol is 5 versus 4. The risk factors are going from maybe 3 up to 2. Now, if we were to put a patient like this on a cholesterol pill, let's just go back to the low risk, which is called a statin, we see it does have some benefit, but only 1 out of 100 people are going to benefit from taking that pill every day for the next 10 years. So one person might look at this and say, sure, sign me up. Anything for one heart attack saved. And other people might look at this and say, well, for 99% of the people who took this pill for 10 years, it didn't do a single thing. So it's a little bit of a personal perspective on which way you look at it. Now let's say, the general recommendation would be weighing the risks versus benefits and the pros versus cons of taking a cholesterol pill for a person who is low risk like this would be against starting a cholesterol pill because of the pros and the cons and the risks versus the benefits. But let's say we have a 60-year-old male who smokes, and I'm just going to take off the cholesterol option right now. Maybe the person has diabetes, and let's say their blood pressure is very high, 160, and their cholesterol is quite high, and let's say they have pretty low good cholesterol. If we took a person, and let's again just leave it the concept of family history here, but if we took a patient with these risk factors, this person is in extremely high risk of having a heart attack in the next 10 years. So in fact, the statistics would estimate this person has a 69% chance of having a heart attack or stroke in the next 10 years. So in this case, this person is definitely deemed to be a very high risk. First and foremost, as an aside, you'd probably want to focus on controllable risk factors such as smoking cessation. So if we change this person to a non-smoker and counsel them on smoking, it dramatically drops the risk down. Let's take away diabetes as well, just for the sake of an example here. So let's say this is a 60-year-old male who doesn't smoke, has no diabetes, but their blood pressure is very high and their cholesterol is pretty high. So this person would have almost a 29% risk of having a heart attack or stroke in the next 10 years. So there's 29 unhappy faces versus out of the 100 faces over the next 10 years. Guidelines would suggest that this person, because they're high risk, which is over 20% risk, that they should be on a cholesterol pill and a high dose cholesterol pill. So by showing this, we could show patients that if this patient takes the cholesterol pill, unlike in the first example with the low risk patient, we're actually saving 10 patients out of 100. So 10% of the people who took this pill over 10 years were saved from a heart attack or stroke, which is actually relatively great numbers.